Hi class, Dr. Lindner. Let's take a look and contrast the male and female um, urinary tract, okay? And with the urinary tract, of course, you're going to see some of the reproductive tract. So let's take a look and let's contrast the male and female. So the urethra is 5 times longer in the male than the female. So let's look at the female urethra. So here we're looking at the female, and on the left-hand side, we're looking at the male. So when we look at the urethra in the female, it's pretty short, right? That's it. When we look at the male, well, look, right from here, from the external urethral orifice, which means the opening, now we're going this way. This is the spongy urethra because of the corpus spongiosum. That's the part of the erectile tissue here. Then we come back a little bit more deeper in this side. Now we're at the intermediate urethra. Then we come back to where the prostate gland is, and the urethra travels through there as well, called a prostatic urethra. So there's the prostatic urethra, the intermediate urethra, the spongy urethra. So when we look at the incidence of urinary tract infections or UTIs, it's much more prevalent in women than it is men because of this shorter urethra in women. Now, also, let's look at some of the other anatomy. Let's look at number 1, number 2, and number 3. So in number 1, so let's look at the anatomy. This is anterior, back here is posterior. This bone right here, this is the sacrum. That's the sacrum and that's the coccyx. So this is posterior. So back here we have the rectum. Here is the uterus. This is where the baby is, right? So this is the vaginal canal. Then we have the urinary bladder, which is where urine is stored, and here's the urethra. So there's 3 openings. You have the urethra, the vagina, and then the rectum and the anus. So with women, it's very important that when young women, when they're young ladies, and they're trained to wipe after utilizing the bathroom, there are problems that can arise if a woman goes to the bathroom, has a bowel movement, and then wipes posterior to anterior, right? If they wipe back to front, then they could very easily bring bacteria in this direction. It's much more hygienic to wipe from anterior to posterior. Now, UTIs can also happen from underwear, right? Just from standing and sitting, you can get this rubbing, and bacteria can rub back and forth in this direction, also giving women UTIs. So have to be very, very careful. With men on this side, what tends to happen after a certain age is men can get an inflamed prostate that's non-cancerous, but it's called benign prostatic hypertrophy. Hypertrophy means enlargement. So when the prostate enlarges and gets inflamed, it can constrict the prostatic urethra. So there's this accumulation and buildup of urine in the urinary bladder. The male feels like he has to go. He's got the urgency to go, but nothing comes out. Okay. Also, look at how close the rectum is to the prostate. And that's why when gentlemen get their prostate examined, it's a digital palpation where the finger has to go through the anus and palpate in this direction to try and see if there's inflammation of this posterior lobe. Okay. Typically, the prostate is pretty highly concentrated in zinc, which is anti and has a lot of antimicrobial properties to it, and for good reason. Look how close it is to the rectum. Lots of bacteria. So if any bacteria jump ship from here to here, this thing can become quite inflamed. So you have to be very careful with that. Okay. Now, in females, females have a urinary tract, right? So you have the urinary bladder, and then urine comes out through the urethra. Babies in the uterus comes out through the vaginal canal. Okay. So urine comes out through here, reproductive baby comes out from here, and poo-poo, right, bowel and stool come out from here. There's 3 different routes. In the male, whether it's urine or whether it's semen and sperm, they come out through the urethra. Okay, and this is why the male has the prostate gland and the Cowper's gland and the seminal vesicle, all producing a type of solution that can alter the pH in the urethra, because the urethra tends to be acidic due to the urine. But what the Cowper's gland produces and what the seminal vesicle produces tends to be a little bit more alkalinic, so it can neutralize the pH so that it doesn't kill and destroy the sperm. Okay,